Hello, let's talk about the differential diagnosis to think about while taking the history uh, of bleeding per rectum. The first is the hemorrhoids. If the patient has painless bleeding per rectum and it is bright red in color and he or she is complaining of constipation, chronic constipation or straining, then we will think about the hemorrhoids or piles. But if the patient is complaining of painful bleeding per rectum, its color is bright red and the amount is few streaks, and the he has a history of chronic constipation or the straining, then we will think about the anal fissure. Okay, the third one is abscess or fistula. If the patient is complaining of some discharge or pus from the back passage and he is also septic look, then we will think about the anal abscess. Okay, then the fourth thing to think about is malignancy or the colorectal carcinoma. So if the patient is complaining of bleeding per rectum and it is also associated with danger symptoms or red flags, so if the patient is bleeding per rectum plus red flags, then we will think about the malignancy. What are the red flags in the bleeding per rectum? It is the weight loss without trying or unintentional weight loss, the loss of appetite, change in bowel habit, which is new change in bowel habit. The third thing is the abdominal pain or bloating. So these are the red flags and a sign and symptoms of anemia. So the red flags for bleeding per rectum are the weight loss, unintentional weight loss, new change in bowel habit, sign and symptoms of anemia, the loss of appetite, abdominal pain or bloating. So if the patient has these symptoms or red flags, then we will think about malignancy or colorectal cancer. If the patient has bleeding per rectum plus chronic diarrhea plus the mucus or slime discharge, then we will think about the inflammatory